Thumbs up, go.
Okay, this is my videotaping for physical assessment 502 for our head, HENT, musculoskeletal, vascular, peripheral vascular, and mental status. So go ahead and open the exam. Hi, my name is Nessa Hawkins. I'm the nurse practitioner who will be doing your exam today. Can you please tell me your first name?
Gregory Hawkins.
Greg, is there any particular reason that you come in today for a physical exam?
Just annually.
Okay, is there anything that you're worried about or that you would like me to go over and pay particular detail to? Any concerns that you possibly have?
No.
No. Okay, great. Can you tell me your date of birth?
5/17/62.
Okay, can you tell me what year it is?
2017.
And who's the president?
That would be Donald Trump.
Perfect. Great. So now that I've established person, place, and time, and his mental status that he's here, I can physically look at him. He's dressed appropriately. He's breathing well. He doesn't look disheveled. He seems oriented to person, place, and time. I'm going to go ahead and move on with the exam. So, Mr. Hawkins, we're going to go ahead and start the exam. It's going to be a head-to-toe exam. We'll start with the top of your body and we'll move our way down. At first, I'm going to come in. I would have washed my hands, make sure everything was clean, and I had all my appropriate materials around. First, I'm going to come in and start with getting his vital signs. I would take his temperature, his pulse, his blood pressure, and check his respirations. So I'll go ahead and do his pulse. Which is about 70. And go ahead and breathe normally for me. Perfect. And I would take his temperature and also do his blood pressure. So Mr. Hart, I'm going to come in, and I'm first going to start, like I said, with the head to toe. I'm going to first come in and feel the patient's scalp, looking for any lesions, any lumps. All the time, I'm always going to be inspecting the patient's skin for color, edema, any lesions, or anything that I might be concerned about. Go ahead and look at the back. I don't see any mole. I see lots of moles, but nothing that I would be overly concerned about. So after this, I'm going to go ahead and we're going to start with, I'm also always inspecting his skin. Go ahead and we're going to start with the eye exam. So Mr. Hawkins, can you go ahead and take a look at me? At this point, I'm going to examine his eyes, looking for any crusting of his eyelashes, making sure his glare is white, not jaundice. Can you go ahead and lift your eyebrows for me? Close your eyes and blink. Go ahead and smile. Open your mouth. On these, we're all checking the muscle, the cranial nerves in his face. So go ahead and look at me again and open your eyes. Perfect. And now I'm going to go ahead and check his eyes. First, I'm going to check his, at this point, I'm going to check his corneal reflexes and his response to light. So go ahead and look straight ahead at me. And go ahead and look straight ahead. His eyes his pupils are reactive to light equally on both sides. Now I'm going to go ahead and check his visual fields. Tell me when you can see this come into view.
Okay.
How about now?
Okay.
How
Now.
about now? Great. Same thing on the other side.
Now. Now. Now.
Okay, now I'm going to check his ocular muscles. Go ahead and focus on this and just follow it where it moves, please. Great, thank you. I'm going to come all the way out and just follow it on in. Perfect, thank you. Pause that. So we just got finished checking his ocular muscles with the H-test, and now we're going to go ahead and do the cover-uncover test. So go ahead and take this piece of paper and cover your right eye. Cover cover your eye all the way. There you go, like that. Perfect. Now uncover it. Now go ahead and do the same thing to the left eye. Perfect. We're checking for strabismus or the eye moving in outside the vision that you don't want. And then now we're going to move on to the fundoscope test, where we're going to look at the patient's eye inside using the machine. Checking, we're always going to go right eye to right eye and left eye to left eye, making sure that we don't bump the patient's nose. So first we would start off having the patient look straight ahead. Put your chin down, open your eyes, and we turn this on and look for the red reflex in the eye. And then you're going to come in and look closely into the patient's eye, visualizing for hold on 1 second, sorry. I don't have that open right now. When you're looking in the patient's eye, try not to blink, visualizing the optic disc and seeing any nerves that you possibly can. Go ahead and do the same thing on the other eye. Go ahead, look straight ahead, straight at me. Looking again for the optic disc and the vesicles in the eye. Don't see any issues, no cotton wool, nothing in the eye to make me think that there would be anything wrong. So we're done with that part of the exam. Now we're going to move on to the ears and nose of the exam. So first off, we're going to start to examine the ears by looking at them for any lesions or any sores. Give a little tug on them. Ask any pain when I tug on your ears at all.
Yeah.
Great. I'm going to go ahead and do the hearing tests, and then we'll go ahead and look inside your ears. So first off, we'll start with the whisper test. Mr. Hawkins, can you go ahead and cover your right ear for me? Perfect. I'm going to say a word and I want you to repeat it for me. Yes. Please cover your right ear. And I'm going to whisper a word and you let me know what it is back.
Apple.
And do the same thing on the opposite side. Cover your ear. Baseball.
Baseball.
Perfect. And now we're going to go ahead and do the Weber and Ryan's test. First, we'll go ahead and do the Weber test. And I'm going to go ahead and knock this on my wrist. And I'm going to put it on the middle of your temple, at the top of your head. And you let me know which ears you can hear the best, or if you can hear it the same on both sides.
Same on both sides.
And then we're going to do the rings test. That's going to test air conduction versus bone conduction. So I'm going to go ahead and hit it and put it on the bone on the back of your ear. Tell me when you can't hear it, and then I'm going to put it by your ear, and you're going to tell me when you can't hear it.
Can't hear it. Can't hear it.
Good. So that side air conduction is greater than bone conduction.
Can't hear it.
inside of the ears. Being, gonna go ahead and pull the ear up and back. Just turn it just a little this way. Pull the ear up and back. You very gently go ahead and look in. Over the tympanic membrane, making sure it's curvy. Maybe visualize any of the small bones. Same thing on this side. Tympanic membrane looks white. Don't see any extra wax, fluid, which is perfect. Great, now we're gonna go ahead and I'm gonna, start by further examining the, head and the neck and the nose. So I'm gonna go ahead and palpate the sinuses for any tenderness. At this point, I'm also gonna palpate the joints. Open your mouth for me. For any clicking or pain.
No.
And I'm gonna go ahead and we're gonna, you can just look up for me. Go ahead and look at the septum, see if I see any deviations. Go ahead and put your head down. Can you, close one side of your nose? Take a deep breath in and out. Same thing on the other. So a little bit of congestion on the right side. And now I'm gonna go ahead and look inside your nose. Be very gentle. Do not poke the nose. You can make sure the sinuses are pink. And that the septum is not deviated and that there's no polyps or any lesions inside the nose. Which I didn't see any at this point. Now I'm gonna go ahead and move on to look inside the mouth. If you could go ahead and say "ah" for me.
Ah.
I'm gonna visually inspect the mouth. Go ahead and lift your tongue to the roof of your mouth. Put your head down. Checking at all the dentae, looking for at the ducts. Looking at the hard and soft palates. And then if you can just go ahead and open your mouth again and say "ah," stick your tongue out and say "ah." Looking at the tonsils. One more time, stick your tongue out and say "ah." The uvula, I don't see any redness or sores or exudate in the back of the throat. Now I'm gonna go ahead and palpate the mouth, making sure there's no lumps or lesions. Go ahead and say "ah" for me again. Go ahead and stick your tongue out. Looking at all sides of the tongue, making sure you don't see any lesions or lumps or any problems. I don't see anything at this point. Now I'm gonna move on to the neck and the lymph nodes and check for symmetry of the neck and also check for range of motion of the neck. So I'm gonna have you go ahead and tilt your head this way, back this way, turn your head this way, and then again to the other side. Patient has limited range of motion, moving his ears to his shoulders. His neck, you can see the tightness. Go ahead and lift your shoulders up. Good strength in the shoulders though. Now I'm gonna go ahead and palpate the nose, starting with the nose in front of the ear and then the nose in the back of the ear. Moving down to the anterior. And just put your neck straight, don't put your neck back. Anterior and posterior cervical. Palpating all the way back to the occipital. Down and palpate follicular nodes. Feel anything swollen at all? Feels good. Now I'm going to go ahead and palpate the trachea. I'll let your neck up just a little bit. pituitary and just like that. Brought it over here. And then I'm gonna go ahead and palpate the thyroid from the front, looking to one side, making sure there's no lumps, nodules. Do this from the front or the back. Okay, go ahead and take it, go ahead and swallow for me. Good, moves up and down with problems. I don't feel anything odd or masses. Everything feels nice and supple. And now I'm gonna go ahead and move on to checking for his carotid artery by listening and checking his JVD, making sure there's no jugular venous distension on either side. I don't see any swelling in the neck. I don't hear any noise. I'm just gonna palpate one more, palpate your temporal artery. While we're standing here and doing all this. All right, now we're gonna move on and we're gonna go over your cardiovascular. I'm gonna listen to your heart, listen to sounds and palpate for your heart. So I'm gonna first go ahead and listen to your heart while you're sitting up. Actually, I'm gonna go ahead and have you lay down. You can just go ahead and lay flat for me. That'd be great. And you always want to examine the patient on the right side, because the heart is on the left side. Go ahead and relax. Are you okay? Are you comfortable? Perfect. First, you're going to start off by palpating the heart, looking for the point of maximal impulse, which is going to be midline at the 5th intercostal space. Just write it out here. Go right on over here and feel. And we'll go back up and we'll feel the 4th and the 3rd. Feeling for any thrills or heaves. Don't feel anything at this point. At this point, you can also recheck the JVD of the patient and see that he's got a little bit of distension how he's laying, but it looks soft. I don't see any aneurysms or any issues at that point. And now I'm going to go ahead and listen to the heart. Listening for S1 and S2, listening for any murmurs with both sides of the stethoscope, the flat and the bell. Start with the PMI. Okay, Mr. Hawkins, can you go ahead and lay on your left side for me? Go ahead and check his heart on the left lateral side. Can you move toward me just a little bit, sir? closer to the body so you can hear a little bit better. What? You okay? Are you in any pain?
No.
Okay, great, thank you. Go ahead and lay back on your back for me.
Dude, be quiet.
Can you go ahead and lay your leg out for me flat? I'm gonna go ahead and feel for your popliteal pulses at this point. You don't need that. Go ahead and feel for your dorsal pulses. And check for capillary refill. Your feet are very cold, but you still have good refill. A little blue. Let's go ahead and switch legs. Same thing on this side. Nice and strong. No edema in the feet at all. Toes are a little cyanotic and cold. Okay, let me go ahead and have you, I'm also gonna feel for your femoral pulses. On both sides. Then we have you go ahead and sit up. Great. I'm gonna go ahead and finish the cardiac exam, listen to your heart while you're sitting, and then leaning forward. Starting again with the point of maximal impulse. And then, Mr. Evans, I'm gonna go ahead and have you lean forward. Keep the neck over. listening to the cardiac and the heart. I don't hear any murmurs. The heart is strong. I can hear S1 and S2. I'm going to go ahead and finish looking at the peripheral vascular system by feeling his pulses, his radial pulses, and his brachial pulse. Same thing on the opposite side. All the time looking for any lesions on the skin or any edema. I'm going to go ahead and check capillary refills on both hands. Perfect. Returns very quickly. So now we're going to go ahead and move on to the musculoskeletal system, and we're going to start with the upper extremities. I'm going to continue to inspect the arms and the elbows, looking for any joint discomfort, pain, redness. Can you go ahead and lift your arms forward? And then lift your arms out to the side. Can you take your right arm and try to put it behind your back like this? And do the same thing with your left. And can you take your right arm and put it behind your back like that? Like this, and the same thing on the opposite side. You can see for Mr. Hawkins he has some shoulder issues. He has a scar on his right shoulder where he has had surgery in the past, and has some difficulty with his left shoulder, with difficulty with the rotator cuff. He also has a little bit of extramuscular swelling up in the right side where he's compensating for this neck. And do you have any pain or tenderness in these muscles right here, sir?
No.
Okay, let's go ahead and look at your hands. Can you open your fingers all the way on both sides? Both sides. Now put them back together. Great, now make a fist. Perfect. So, and then go ahead and relax. I'm gonna put my hands right here and push your arms against my hands. Perfect, do the same thing. Perfect. Okay, now we're gonna go ahead and do the Allen's test on both hands. Gonna occlude. Go ahead and pump your fist. Turn to white and go ahead and release. And it perfuses all the way back through nicely. Same thing on the opposite side. Just wait 1 second, sir. Go ahead and pump your hand again. The hand turns white. And it perfuses nicely once I remove my hands. Now we're going to go ahead and do now I'm going to be checking for carpal tunnels or issues with the nerves. I'm going to do the TINS test. Do you have any pain when I do that?
No.
Now we're going to go ahead and check the test, where Mr. Hawkins has a little decreased range of motion in that area. Do you have any numbness in your fingers when you do that?
No.
No numbness in your pinkies or your hands or anything when you do that?
No.
You could do it prayer way too. Is it easier for you to do it prayer way?
No.
No numbness or anything?
No.
Okay, perfect. Great. So now we've gone ahead and assessed the range of motion on the upper body, checked for carpal tunnels with the 2 different tests of the hands, and now we'll go ahead and we've checked the capillary refills. Now we're going to go ahead and work on the lower extremities. So again, I'm always looking at the skin, looking for any lesions. I've already checked both legs for edema, and I've checked both legs for his pulses. The other thing I wanted to check for is if you can go ahead and pull your toes towards you. Do you have any pain in your calf
No.
on either side? And then on this side? Great, so that's
No.
the negative Homan sign. Go ahead and push your feet against me, right? And go ahead and push your feet down. Perfect. Do the same thing with your leg. Can you go ahead? Perfect. Same thing. Great. And now I'm gonna have you go ahead and stand. And we're gonna continue to check range of motion. Can you go ahead, I'm gonna examine his spine. Can you go ahead and touch your toes, sir? Good, curvature of the spine, a little bit greater on the right side than the left. That may be due to the surgery that he's had on that side. His spine altogether, turn this way. Looks straight, his curvature is fine, there's no spondylosis or anything like that. Mr. Hopkins, can you go ahead and walk that way for me? Just regular walk. Now turn around and walk back on your heels. And do it one more time, walk back on your toes. Perfect. And if you come back over here, can you go ahead and stand, put your one leg up like this? Do the opposite leg. Move your hip out. Go ahead and move your hip in. Great. Any pain, any discomfort in either of your hips when you're doing that?
No.
Perfect. Then go ahead and take a seat for me. And that should, I also wanted to make sure on the skin that I noted that everything was symmetrical and there's no varicosities or any veins that I would be worried about on his legs anywhere. And that would conclude the exam from the head, doing the HEAMT, musculoskeletal, cardiovascular, and mental status.